when you can create something like this, it is a movement. It's like at another level. And honestly, even internally at a pharma company, this was transformational for their culture. It was like nothing that anyone ever experienced or thought would happen. Mind blowing.
Hello, and welcome back to the Supreme Pod, where we talk about all things marketing and communications for life science and healthcare. Today's episode is all about marketing and communications, specifically in the rare disease space. As always, I'm your host, Eric Southwell, along with my co-host, founder and PhD scientist, former PhD scientist, Paul Avery. Though once a scientist, always a scientist. Is that how it goes, Paul? I'm not really sure.
I think that's fair to say, yeah.
Okay. Good. And so for this conversation, we are welcoming Liz Kanter, who is the president and executive creative director of Pivot Design. And Pivot Design is an award-winning healthcare marketing agency, most recently winning silver in the MM&M Rare Disease Agency of the Year. Liz is an expert in branding, creative, and marketing with a focus in rare disease. Liz has helped pharma and biotech companies in these areas for over 25 years. Liz, thank you very much for joining us.
Thank you for having me.
So jumping right into it, Liz, I think it'd be awesome just to get a little bit of an intro. So how did you find your way into the rare disease space and what kind of drew you into this specialized area?
Yeah, absolutely. I would say it was about 20 years ago. One of our clients was working in two rare therapeutic areas, hemophilia and primary immunodeficiency. And I didn't know a whole lot about those disease states. It was just sort of, one of those, okay, there's a project. It was to develop a school toolkit for kids that are living with hemophilia. How can we educate teachers, administrators, people working in the school about how to have a child with hemophilia in the classroom? And it was just sort of, to me, like, okay, a project, we have to execute on it. I quickly learned it was so much bigger than that in realizing that the hemophilia community and the primary immunodeficiency community are so tight-knit. It is so personal. I went and sat on advisory boards with parents, with nurses, and I quickly was just drawn in. And there was no question. It was where I needed to be. And it became deeply personal. And it wasn't just a project anymore. It was a passion. I cascaded all of that to my team and, really shared some of those insights that I learned on that advisory board. And, all just were fighting for creating the best tools, the best resources, the best educational assets that could help really live with a disease in a better way. So that's how we got into it. And from there, I would say, now we've had experience at Pivot working with, probably 20 plus rare diseases, some of which are ultra rare, others are less rare, but they're all very similar in terms of the passion that the communities bring. Also, just even the marketers that we work with carry a very different, I would say, way of working that's really refreshing and liberating and gets you out of bed every day. There's no question. And I love it. I can't imagine not working within this space.
So some people might be listening and might not know a ton about rare disease. And so what is it like working in rare disease? What is meaningful about it? What's surprising about it? Like, I'm just kind of curious, like, what is it like working in this such a specialized niche space where you have to learn so much about such a specific kind of niche disease? What is it like?
It's so different than working within, let's just say, diabetes, right? Something that is so broad. You have a very diverse patient population and, you're connecting at a very broad level as compared to within rare. Some of these disease states, you're talking about 500 patients in the US. It's a very, very tight-knit group, oftentimes know each other. They're leaning on each other within advocacy groups, organizations, social media. These communities are coming together. I think that what it's like is it feels as though we're part of that community. So while we may not be living with the disease state, we know that we are helping them. We're listening for additional unmet needs, or as the community might be talking about, hey, we're really having trouble with self-infusion. It's really hard at home for it not to be scary for my child. And you get that insight and you're immediately like, I want to solve that, right? Because there's these personal connections. I've met so many parents that I've bonded with. I'm Facebook friends with now. We're texting, and it is just at a different level because you're talking about just this feeling where they feel very alone. If you're one of 500 in the US, you're sort of, gosh, I don't want to be defined by this disease. How can we support that and make them feel like they're not? And that is, I think, the power of working in rare. You really see the work that you help contribute to helping change lives because the community is so small. Where I think when you're working with, like I said, something within diabetes or a heart condition, it's hard to see the impact of that work. And really, I think brings so much purpose to what we do every day. And I know my team feels incredibly inspired by it.
I got a
Yeah.
question for you on that one, Liz.
Yeah.
Like diving a bit deeper into that, if you're trying to communicate with a patient population that's 5 million people versus 500, it's going to be a very different approach you take. So
Very different.
how do you customize your approach to build that relationship over time with such a small group of people?
Yeah. It's interesting. When we, let's just say, undergo a disease state education initiative for rare disease, we are looking at it from a very different lens. Of course, there's always social media and sort of the broad-based tools, but it's really grassroots. We are oftentimes engaging with advocacy organizations right out of the gate. Those organizations have built this community. We are attending walks. We are attending, if there's chapter events or meetings, we are listening to webinars and just hearing from them, building those relationships. I think that, you're getting incredible insights from a smaller population to then inform how we can support them. So it is so grassroots. It's interesting. That get it factor, that connectivity, it doesn't often cost a lot, right? When we think about marketing and we think about new campaigns, it's always like, oh, dollar sign, dollar sign, dollar sign. A lot of what we do is very tactile, very grassroots. Oftentimes, you know, doesn't cost much at all, but it's ways of engaging with the community at, let's just say, a conference. And maybe they're going to make a custom bracelet that has the name of their loved one on it or something just very tactile. And I love that about it, that it doesn't take these big blockbuster budgets to really connect. And I think that's one thing that our clients keep coming back to us because it's this get it factor of right sizing solutions for the community versus us coming in and saying, oh, you need this large scale omni-channel campaign. It's not always right. It's actually just much more grassroots.
I love that. It doesn't have to cost a lot, and yet that level of empathy is almost priceless, right? Being able to have that
Absolutely.
emotional intelligence.
Yeah, I think it's something that I can say if there's sort of that like secret sauce or that thing that people keep coming back. It's that emotional intelligence. It's that get it factor that we always challenge ourselves. And, empathy is one of our soul drivers at Pivot. We have these soul drivers that we always ladder our work to. When you can lead with empathy and connect to the audience, I mean, the results are just incredible. And that is what it's all about. So if we are working in rare disease and oftentimes in an unbranded space, those connections are creating then brand loyalty, right? To the master brand, to the product level in a way that is really authentic. It's not scary. It's not, oh, there's big bad pharma. It's really, really real. And I think our clients have really seen that it works, that it's a beautiful way in to supporting a community with an incredible product and a changing your life product in a safe, empathetic world.
Let's say somebody reaches out to you, and I'm sure this happens all the time. It's a rare disease that you've never heard of because they are very niche. And what is your process? Like, how do you immediately, like, let's say you start with a client, do you immediately go to Reddit? Do you immediately go on Facebook and look for support groups and see what
Yep.
people are saying? I'm just curious as a marketer. And let's say I'm a junior marketer at a company and it's my first day working in a rare disease type product. What does that look like to just kind of get started with something like that?
Absolutely, Eric. I think the social listening piece is huge, and we always start there and really try to join as many groups as we can to get insights that are the real deal. So we always start with the social listening. In addition, we'll often try to find an HCP or KOL within the disease state that we can have a conversation with, that we can learn what it's like to treat. What are the challenges that they're facing when a patient comes in and gets diagnosed? What are the tools that HCP also maybe is lacking, or where is their patient experiencing a lot of fear and sadness and that emotional side? So we'll always, in addition, lean in there. And, I think you get such great insights from just the social listening, to be honest. Of course, we'll always engage with our clients and ask for any and all market research that exists. If they've done, all of that, it's a very laborious process in terms of thinking about the, population and what that looks like. It's insight gathering. But I think the social is really that real raw where the rubber meets the road and how we can meet a community. That's the best place for us to get up to speed.
It's pretty unique. I know Paul and I are definitely, well, Paul's pretty well rounded in pharma, healthcare, life science. I'm a little more specialized in the life science space. I can't imagine being Facebook friends with somebody that bought a beaker off one of my Google ads. I think that's pretty unique and special to Rare, but it makes a lot of sense because, there's not a lot of information out there, and the best way to get it is from people who are actually experiencing it. So I think that's super cool.
That's right.
Eric, I think you raise a really good point there. And Liz, I'd really love to know what it's like when you're dealing with these small communities. I can imagine that they do grow and change, but at the same time, they're kind of static. So you're having ongoing communications and relationships with these people. Like Eric said, he's not building a relationship with someone who's like, I got to buy my 5th beaker because the other 4 was so good. How does that affect you as a person? How does it change how you market and communicate, knowing that you're going to have to be in this for the long haul?
I actually think building the relationships with the patients, the caregivers, and the community just makes us stronger. I think the closer we can get to the communities, and I'm even talking about, let's just say our clients, they're patient advocates, and those on the front lines that are answering the phones, that are supporting these communities on the behalf of the pharma company. We stay very, very connected with them as well. I think that there's no question there's a foundation of let's just call it support platform, right? So what are those educational tools, resources, all the things? I think that where pharma companies shine is when they do listen to a new unmet need, right? So let's just say it's a taboo topic that, in COVID, there was a lot of that going on and sort of, okay, do we cross the line and explore a topic that's maybe more sensitive? We only get that from the patients, caregivers, and the advocates. Like that's where we're getting the real insights to say, okay, yeah, we need to meet the community in a new place. And I actually think it's wonderful because we're just building, evolving, changing. Sometimes we're sort of like, yeah, that tool has run its course. We need to update it. How do we make it better? And really, it's engaging with those communities to help co-create. That's when the best work gets done. It's that co-creation of let's do this together. And I would say even on our HCP unbranded tools, that is just where the magic happens when they are involved in helping us make that sausage and they love it. It's, I think, incredibly gratifying to know that they're contributing to, again, solving an unmet need bigger than writing a script.
One question I have, Liz, is, you've been working in Rare for such a long period of time. What's the difference between Rare today and Rare 10 years ago or 5 years ago? And is there any trends in terms of where you see it going in the future?
Yeah, I think there's no question the social media landscape has changed Rare. There's, I think, a lot more connectivity within the communities now that they can connect with one another. I think with that has come a greater level of advocacy. I think that being your own advocate, having a voice, speaking up, being vulnerable, that's something that social has allowed a lot of people, a platform that feels safe. It's maybe a little bit shielded. We can say more potentially, right, if we feel more comfortable. So I've seen the advocacy side just skyrocket. I think that communities are feeling more empowered. They know they can make change, where before it was maybe a little bit more sit back, take in, thank you, gratitude. Now it's, hey, let's do this together. Hey, you know what we need? We need this. And it's amazing because you can see the patient empowerment. And that's one of the things that we work on all the time, that we're constantly trying to foster even greater patient empowerment and a stronger, louder patient voice. But I think most recently in the last 5 years, even coming out of COVID, you think about how just the landscape has changed from kind of telemedicine, right? And how we treat is even different. I think people are, quite frankly, just having a louder voice, which I think is great for those communities, and seeking more change, seeking better answers, not afraid to ask really real questions.
Yeah, I think that's a trend in the world, and it is a positive thing about the
Yeah,
internet and social media. I mean, I know
absolutely.
this is true for, not to get off too much of a tangent here, but this is true for music too. I mean, if you were trying to be a famous musician 40 years ago, if you couldn't get on the radio, you really didn't stand much of a shot. And now
Right.
you have YouTube. And so you can create a micro following of 100,000 people, and you can actually sell out shows and stuff when you go on tour. And so it's sort of the decentralization of everything. And that includes rare disease. Like, you can be on a subreddit of 1,000 people or 2,000 people, and
Right.
it can be really, really active. I remember when histamine intolerance was sort of a new age, or like thing that people were talking about maybe like 5-10 years ago, and the subreddit was tiny, like it was a few thousand people, but it was super active and everyone was helping
Right.
each other. And so I think that is one of the positive things about, the world we live in today, which I'm sure is a lot different than, 10-20 years ago. So
Absolutely. I think too, people are seemingly more willing to tell their stories. They're more willing to be vulnerable. And that sharing, I didn't see as much 20 years ago, 15 years ago. It took a lot of convincing a patient to get on a camera and do a video or do an interview. And now we have a lot of people wanting to share their voices and stories, and it's liberating. I see it, and I'm just so grateful that they feel supported, they feel safe. I think just in terms of, the vulnerability we've even seen from celebrities that are living with a disease now. And that didn't happen 20 years ago. It was all behind the curtain. You didn't know. And I think that now we've created a space where it's accepted and there's understanding. And I love seeing that, because that's just going to make us all better as humans and feel more connected. And I would love to just continue to see more of that.
love it. Pivot recently won a pretty
Yay.
prestigious award, MMM, which is always hard to say, but I did okay. I heard somebody say triple M recently on
Triple
a
M.
call, and I was
I
like,
have heard that too. Yeah.
I'm going to start doing that. Congrats, first of all. I
Thank
know I've already
you.
told you. But when it comes to creating an award-winning campaign, what is sort of the pivot special sauce that sets you guys apart from maybe other agencies?
Yeah. I think the special sauce goes back to truly the get it factor. I really do. And I think it goes back to meeting patients and communities at the right altitude and the appropriateness of those solutions. It's about the empathy and connecting with them at the right place, the right time, in the right way. I would say those campaigns have ranged everywhere from the very grassroots and tactile campaigns to the broader, bigger omni-channel campaigns. But what shines through is just that get it factor. It's not being afraid of a tagline or something more provocative, right? That's going to have the community remember it and go, wow, that pharmaceutical company gets me. They understand. They're not afraid to hit me with something that is more interesting, quite frankly. And so I think that inevitably what MM&M saw through our work, and so for Rare Disease Agency of the Year, we submitted a wide variety of work from a wide variety of our clients. And I think the one thing that shined through was that soul, that get it factor, the empathy, the authenticity, the courage, the clarity. Those things are in everything we do. And so I think MM&M saw that, and they saw that, yeah, it doesn't mean always flashy, smiling, happy people holding hands on a beach, but instead it's how we tell stories of people living with hemophilia in a unique way, where they're writing songs about living with their condition, and this deeper level of understanding versus the typical pharma as we see out in the world each and every day, that sea of sameness. So I think Pivot breaks through all of that. And over our 30 plus year history have continued to do that in all aspects of our work, but specifically in rare. I think it is just the perfect fit for us.
I just want to double click on that quickly, because again,
Yeah.
I think authenticity and emotional intelligence are really easy things to talk about, but they're really hard to demonstrate and deliver on. So what role does listening do those patients play in how you come up with and execute these campaigns?
Listening is by far the number one thing, I would say, right? Listening to the patients, listening to the HCPs, doing the social listening, the community listening, listening to advocacy groups as well. A lot of times it's those partnerships with the advocacy groups. They're doing so much great work. How can we help them? How can we help augment that? I think, every good relationship is founded on listening. And so I think if we listen appropriately and also ask the right questions, I think while we can be an active listener, also just participating in that and not being afraid to ask those questions that might be a little bit more provocative, might kind of go a little bit deeper, that builds trust. And I think that the more we can do that and show that, and then take those listenings, take those insights and turn them into tools and resources that connect, that the community is talking about, that the buzz is happening, that the HCPs feel like, oh my gosh, these are wonderful for my patient population. Suddenly, it's just this beautiful, trusting, lovely relationship of support. And that's what it's all about. But it all starts with listening without question.
How do you do that? I love this idea as well as being willing to ask the harder questions, but to make it a safe space where you can get to the true insights, like the 5 whys and really trying to understand someone at their core level. But then turning that into campaigns, you mentioned about being provocative, interesting, memorable. How do you walk the fine line that's present in an industry like pharma that's heavily regulated and we have to be careful? What does that look like?
It's not easy. I will say, I think that courage word, that taking the risk, it is definitely a challenge. I think that for us, we will always take those patient insights. Hey, here's what we're hearing. Here's the why. Here's the reason why you should stand behind this and do this. And then we're going into MLR meetings, so medical, legal, reg, and bringing those reasons why to make a case for, let's just say, a risk of messaging or a tool, because it's highly regulated. I think that without those data points, it's not going to be supported. We have to have those data points that show, hey, there is an unmet need. You can break through. You can be that trusted partner. And then just having those candid conversations, I think it takes time. Sometimes it's not going to be one meeting. It might be 10 meetings with a core group of people and really trying to mitigate that risk. Of course, if there's risk, we need to mitigate it. We need to make sure that we're being really smart. But it's not easy. Honestly, it's challenging, but I think that's our job, to constantly push, to constantly, partner with our clients. And they are incredible partners. They are wanting to meet the communities at the same spot. And so it's just having a lot of grit, a lot of resilience, and not giving up.
I love that. What I'm hearing you say is you have to believe in that idea. If you're going to sit in 10 meetings and push for it to be a reality, you have to believe in it.
Absolutely.
And so therefore also, what role does experience play, right? You've been in this industry for a number of years. You will have a radar or a sensor that tells you what's going to fly in the market and what's going to get you in trouble. Like, how do you bring that to bear when you're planning and executing these campaigns?
Yeah, I do think that same sort of the data, the experiential, hey, here's an anecdotal or an analog that our legal, medical, regulatory friends can see, hey, this is out in the market. We did this. It was met with incredible response and results. So therefore, this is going to be okay. So we'll often bring those analogs forward because I think, we all feel more comfortable when we're like, okay, they did it and it's okay. So finding those sometimes can be challenging. And oftentimes too, you have potentially a team of marketers that are just like, no, we are going to fight this fight. And it does take strong marketing partners. And we have a lot of them, which is incredible, that are in the arena, and they don't want to just be doing the same old block and tackle, here's another insert. Of course they're needed, right? We know all of those tools are needed, but those that have chosen to work in rare disease for a pharmaceutical company are there for a reason and a purpose, and they want to solve for that unmet need. So they're willing to take the time and the relentless energy to get something approved.
I really liked hearing the sea of sameness from you, because that's something that I see all the time in pharma marketing.
It's everywhere.
And how do you break out of the sea of sameness if you're pivot? I mean, I'm sure experience has something to do with it, right? And having some confidence around it, but I'd love to hear your thought process around that.
Absolutely. As part of our listening and insight gathering and looking at competitive landscape, as part of our creative process, we'll always have that front and center for our creatives to know sort of what the competitive set is doing. And then when we go back in and present an idea, let's just say for a campaign to our clients, we always show, hey, here's that sea of sameness. I mean, it's, hey, everybody looks the same, walking down a beach in brand colors with smiling, happy people. And listen, we've worked on those too in the past, right? So I think that there's always, as a part of our creative process, challenging ourselves. So as we sit through a internal review here at Pivot, it's our job as creatives to challenge that. And to, if we see something up on the board that is not meeting one of those soul drivers, that isn't pushing the boundary, we have those candid conversations. It needs to break through. I mean, it's always just really, really push, push, push. To be honest, oftentimes then you take that into the client, meaning our pushed directions, and you simply show the sea of sameness, and they're like, oh yeah, we do not want to be like that. Right? You look at the color blue in pharma. If you look at brand landscape for pharmaceutical companies, it's everywhere. A lot of people feel it's safe. You show sort of, how are you going to stand out? You put a magenta logo in there and they're like, yeah, like I've got energy now. I've got ownability. And I think that's the thing. I think it's just validating it with the competitive market. And then it's our job as creatives to continuously push each other, be inspired by what's around us outside of industry, not even within pharma and life sciences and biotech, but how can we look outside and be inspired by marketing that's being done in other industries, in tech and fashion or whatever it might be that's compelling, and to bring that forward. So it's something that I think everyone we also hire and our team, they're incredible creatives that are always wanting to push. We don't do this throw spaghetti on a wall thing. It's regurgitating ideas. I've seen it time and time again.
I'm really curious from a operations perspective, because you talk a lot about your soul drivers. And do you ever come up with some? I also, by the way, have a lot of respect for creative people. I don't consider myself to be a creative. I'm more of like an analytical brain, I would say. And so I'm always curious if there can be process around creativity or if process stifles it. And so is there ever a situation where you guys come up with a really cool angle? You're in the original like sort of brainstorming ideation phase, and then you have to run it through your soul drivers and be like, hey, is this meeting soul? Is this meeting authenticity? Is it meeting courage? If it fails the courage test, then we have to go back to the drawing board. I'm just curious of the process of that.
Absolutely. I would say as a part of the creative solutions, we also don't feel that everything has to hit every soul driver. So oftentimes, as we look at creative for a client presentation, we're always wanting to present a range, intentional range. So and this is all based off the intake and the creative brief and what we learn from the client in terms of where they want to be. But even within that, you're going to go from conservative or safe to really pushing boundaries. And within that, there might be different soul drivers along the way, right? Maybe the safe one brings in more empathy, right? If we think about being empathetic and what that feels like. And then the one that's over here is all about courage. It's that witty headline that's maybe going to make you think twice about that. So we'll look at that spectrum and make sure that there is at least one soul driver for each of those directions or multiple. And then when we present, as we showcase concept A, we will lean into, this is all about empathy. And here's what that means. And it might ladder to another soul driver as well, but we're always pressure testing that. And it is now a part of our creative presentations where we make sure that our clients see that pulled through.
While you were taking us through some of the underpinnings of these campaigns and having to make decisions about whether to be provocative or not, you mentioned some key emotions, right? Like humor and making people laugh. I can imagine that making people feel safe, giving people hope. What do you think are powerful emotions that can work well in your campaigns? What are the emotions that you would never touch?
I don't think that there's an emotion that's necessarily off limits, because it is all about being real and authentic. I think if it's real and authentic, if that emotion is something that we have been able to validate through our listening and the communities that say, yes, there are a lot of people that feel this way, I think we absolutely would put it forward. If there was an emotion that wasn't validated by insights, we wouldn't put it forward, but not out of being afraid of going there. It would just be that it doesn't resonate. We want the patients to say, they understand me and they get me. And so I think that's really how we would validate what emotion we'd put forward.
I love that. That's a different lens completely than I imagined when I asked the question. And I love the lens because what I'm hearing you say is we're going to communicate with patients where they are because they are the most important thing of this whole endeavor. And so
Absolutely.
whatever's on their minds needs to be on our minds. Like it's not that it becomes taboo. It's only taboo if it's irrelevant to them because why would they care?
That's right. Absolutely.
That's super interesting.
So Liz, I feel like a lot of this has been super interesting and also talking at a high level. And I'm just curious if there's a specific campaign that you'd feel comfortable talking about. A campaign that stands out to you. What was the initial problem that you were trying to solve? What insight did you sort of uncover that guided the creative process? So if you feel comfortable, I'd love to hear kind of a specific one.
I would love to tell you the story about, I would say, probably the project that is the one I'm most proud of in my career. It dates back, and I think that even means more because it isn't something that we did last year, but it's something that was 15 years ago. And that tool that we created is still in the reps bag today. And I think in the world of marketing, you often see a new marketer come in, create a tool because they need to put their mark on. And I think the fact that this is still in the bag just says, talk about measurement and something working, that it's working. So 15 years ago, our client came to us and said, there is an unmet need within primary immunodeficiency, which is ultimately living without an immune system, right? Those antibodies, aren't working. And that's the simplest way to put it. Sort of think boy in the bubble is primary immunodeficiency. They came to us and they said, we are hearing that we need to support children living with this disease. It is really scary to have to go into an infusion center to get infusions. You're talking intravenous infusions in the vein. They take a long time. They're out of school. And then those kids are sort of not wanting to get more infusions. So they're just not talking about feeling sick. They're not communicating, how can we do this? And so we worked with a woman that is still with this pharmaceutical company today. She is a patient advocate galore, like incredible, best I've ever worked with. And we ultimately connected with a child life specialist. And that child life specialist, we sat in a room and we riffed on ideas. We brainstormed, clean sheet of paper. And what we realized is that there was this opportunity to lean into this concept of therapeutic play. So how can you use play as a vehicle to talk about your disease state, how you're feeling, and make it more normalized? As a part of this, we were like, okay, we're going to develop a therapeutic play kit. And no one was doing it. This was, again, courage, is empathy, and a big undertaking if we think about at the time what this was going to mean. We obviously needed to gain a lot of insights, understand, work with the child life specialist, work with the community, and make sure that we had one shot to get this right. And so we went out to a medical center and worked with the child life specialist. We had in-person meetings. We brought our client was there, patient advocates there. We had patients that were there in the room, children, to help us. And basically, we landed on this adorable, sweet stuffed animal. And he is a patient's friend. He joins patients at infusions. He comes with a full medical kit, which includes tubing, an IV bag, Band-Aids, all the things. I got to show you the bear. He's right here.
Yeah, I get him.
Yeah, let's see it.
I mean, my goodness.
Such a cute bear. I love it.
So cute. He's amazing. And he comes with a series of books. One book that basically talks about you're not alone. Another book for the parent to learn how to engage in therapeutic play. Another book, a sticker book for the kids to sort of engage with them to say, hey, how are you feeling today? How's your animal feeling today? And they would put a little star on where it might hurt. Things like that. So we developed this tool and we launched this tool, and we launched it at a patient conference. We could not keep the tool in stock. It was, every patient that came by, and then, it was in a little backpack on their bags, and they're walking through the conference. And it was the most magical, wonderful moment to see these kids' faces, to get their stuffed animal and their bag of infusion supplies and see that other kids were just like them, right? And we then saw this stuffed animal go viral. So we saw him go viral on social. He had his own brand. He was manifesting in a way that we had no idea that this was possible. And we then developed a mascot of this little stuffed animal. This mascot was like, the guy that's at football games that's getting everybody jazzed up. He went to every advocacy walk. He also helped internally at meetings rally the teams. So we were sort of taking the community now into the corporation. He was like everybody's favorite person, right? And so we were creating this brand and we didn't even know what was happening. We then were listening to the community and they wanted to hear more from this stuffed animal. So we created magazines that went out quarterly. It's to the patients' homes, and it was all educational. We then learned that they wanted to meet this animal. And so we created a contest of, hey, you can submit to win a visit from our mascot. And as a part of this story, we then learned that there was a family that the little boy was very, very sick. And his one dream in life was to meet the stuffed animal. My friend, colleague is like, gosh, I really want to make this happen, but talk about a legal med reg situation potentially. And this is my proudest moment. And I'll never forget like where I was and how it all went down. So we called a meeting up at corporate headquarters. It had legal med reg in the room, my patient advocate colleague, marketing in the room. And basically my advocate friend shared the story of, hey, there's a dream that this little boy has to meet our stuffed animal. How do we make this happen? Let's make this happen. And how do we also tell this story to more people in this community and show them that they're not alone? So within 1 week, we got every piece of documentation signed to allow for the visit from a safety standpoint, right? Pushing the boundaries, talk about courage. This was a pharmaceutical company that believed in patient first. And this is like, I tell it all the time because it's so just empowering and refreshing to think that they took this risk. And within 1 week, we showed up with a film crew with our full-size stuffed animal, and we surprised this little boy with a visit. And we documented the whole thing. And that is by far the best day in my professional career to this day. I got to connect with the family and learn that this tool has changed their lives. I got to learn that this stuffed animal was this little boy's best friend because he lived in isolation all of his life. And it took on another level that I didn't know was possible. I didn't even know that what we were doing in this creative space of working within this community had such an impact, right? And every single year I reflect on that moment with my colleague, and we are just so proud of our client for taking that risk and believing in doing what's right and creating an incredible tool that's still in the bag, that's still resonating. I honestly, to this day, am still connected with the family and that little boy who's thriving. He actually spoke at our company kickoff last year. There wasn't a dry eye in the room, not a dry eye, because I think you just realize how powerful these tools are. So sorry, Eric, that was a really long story.
So good, though.
And, I think that it's just a testament to, again, doing what's right and that grit and that resilience and just continuing to push. But in this case, we had one incredible client that did what was right. And that is just something I will never, ever forget. And that's what it takes. I think to work in rare, you have to be willing to go beyond that block and tackle solution. You just have to. To this day, I think I will say we probably get an email in at least like once a month from a patient wanting this tool or a caregiver looking for it. I mean, it's incredible.
Still to this day, the same play kit.
Yes.
Wow.
Yeah. So it's I'm really very, very proud. And I know my team is too. So
do you know
what
what
an incredible story.
I get asked, you know, when it's like someone says, "Oh, what do you do?" And you say, "Well, you know, I work in marketing and communications." And I think people have
yeah,
a very specific picture in their mind of what that is and what we do. And I want to take that 4 minutes or however long that story is, and I just want to show it to them because
right.
that is what we do at its
Right.
absolute zenith of how you can massively improve people's lives.
That's it.
And what an inspirational but also probably quite challenging yardstick to set yourself to try and meet
Oh
with every
yeah.
campaign, but at least you know what that looks like and you can aspire for it with each new campaign you work on.
That's right. And the question you had asked me before around, how can you convince a pharma company to take a risk? Showing that, right? Like, hey, we did this, and this is what a company stood behind and took this risk to do what's right. And think about the loyalty in this community now to this manufacturer. It's real. It's real. And, I think it's something that, yes, with the bar set very high, but it's also what an inspiration for us to continuously have and push ourselves there. And it's funny, I always also say it's 15 years old. Great marketing, great tools should be enduring and stand this test of time. Of course, we could make updates and shifts and, have him grow up a little bit with us, which we would love to do, but it's not overly necessary. The tool still works. And I think that's another thing. Like, how do we continuously make sure that we're creating tools that aren't just having a shelf life of 6 months or a year? I mean, of course, I'm not talking social media and the digital age, but those more meaningful, connective marketing tools, they should last a bit if they work, if we did our job the right way.
Yeah, it reminds me of the saying, slightly different, but like buy cheap, buy twice. There's an element of
Right.
let's do this properly. Let's really listen to our audience and what they care about. Let's think carefully and creatively about how we make their lives better. And then let's go all in on it, right? Let's make this
Right.
awesome. I
Yeah.
bet that doesn't happen as often as maybe it should. What are your thoughts?
No, I would agree. It doesn't. I mean, I think we are living in a very fast-paced world with a lot of pressure and, we know things are changing within the healthcare landscape and pharma landscape every minute right now, and it's a pressure cooker. There's no question. So, it is hard to sort of slow down and make sure that we're crawl, walk, run, and do this the right way. It's challenging because there's high expectations and oftentimes deadlines with launches or, things that can't move, especially in this world we live in where everyone's trying to optimize omnichannel and what's the next omnichannel thing. So this is a different way of thinking beyond what everyone's doing. We all need omnichannel. It's not going anywhere, and let's go get that work too. I don't want to like cannibalize our work, but I think when you can create something like this, that it is a movement. It's like at another level. And honestly, even internally at a pharma company, this was transformational for their culture. It was like nothing that anyone ever experienced or thought would happen. Mind blowing. So, I mean, he has brand guidelines, this guy.
How do you even put a number behind a story like
Yeah.
that? It's like how do you measure it, I guess? I mean, you
Right.
just kind of said it, but it's probably different than maybe more what I'm used to, which is kind of on the performance digital side of things, where
That's
it's
right.
cost per lead and cost per click. Like, it's completely different where you guys are at. So how do you think through that?
Eric, it is completely different. And it is a challenge we are often faced with within an unbranded disease state education world of measurement. I mean, there's no question when we're talking about an engagement. So a lot of the work that we do is within the community. It's, hey, how many patients did we engage with that maybe made that bracelet at that conference? Okay, so we had interactions. I mean, I think there's certainly a interaction component. For us, the measurement comes from the community. So if they're talking about an experience they had on social, if they're talking to their advocacy group saying, hey, that manufacturer really understands us, we're excited about potentially thinking about this product, switching, it's a lot of anecdotal. That's hard, right? So we capture all of that, but it is hard in a world of data analytics and measurement, that so much is sort of about the stories we tell and the connectivity. It's witnessing that conference of the kids with their little bags with the stuffed animal. Nothing can take that away than knowing we won, like we succeeded, we did our job. But, data would say, okay, how many did you hand out? Yeah, we can count, right? We can look at those things, but it's so much bigger than that. We just worked on, I'd call it a movement for a launch within rare disease for a large pharmaceutical company. And that movement was going to be launched at an advocacy event. And it was going to be a dinner program where we invited the patients' caregivers to the dinner program. We had a really powerful rally cry that was memorable, that you wouldn't forget. The visual look, feel, experience was not expected. It broke through that sea of sameness, Eric, right? It was not something you see out in the world. What we heard, and we had a team on the ground, obviously, as a part of this, it was just the smiles, the feeling of they understand me. This was by far the most informational and fun dinner program we've ever had. Wow. I didn't realize that I was surrounded by other people that think like me, that are living with the same challenges as me. And leadership at this pharmaceutical company, we got a beautiful love letter around, thank you for listening. Thank you for helping us show up authentically with empathy. Man, you really helped connect this community. And that's measurement for me. I framed that email, and that's what it's about, is the community's talking, the manufacturers feeling like, okay, we are showing up in a way that is meaningful and purposeful, breaking through that sea of sameness. So, how could you measure that? You can do a survey, pre-event, post-event. Like, there's those things that we do all the time, tried and true. But really, when it's something that everyone's walking away feeling that their heart's more full, and that's everyone from a patient to a caregiver to the manufacturer, that is like what it's all about. That's our job. We're proud. So proud. I'm so proud about that experience. And my clients are proud. And the advocacy group, everyone's happy. Yes, more. Let's do more of that.
Right. Not everything that counts can be counted, right? Like
right.
I think in marketing, quite often what we're trying to do is create raving fans. But that's really hard. Like, I can think of loads of campaigns I've worked on where we probably didn't create any raving fans, right? So if you get a couple of those letters or emails around a campaign like that, you can bet there's another 100 or 200 or however many people who feel the same who maybe didn't send that letter for whatever reason. Just to get one is sometimes rare magic, right?
Really? Yeah, that's right. It's a big part, right, of thinking about inspiring marketing teams and why they're getting out of bed every day. And this is a tough industry we're in. They're working long hours. It's hard. So keeping them inspired is also very, very important. Keeping those commercial teams inspired.
Right. 12% uplift in scripts is definitely going to help at bonus time, but it's not a thing that makes your heart swell when you think about what you're doing with your life. So I do think that's critical. I also think it's the thing AI cannot replace. Like, AI just does the average of everything. As you said earlier, by definition, whatever campaign in pharma that AI comes up with is going to be blue because all the examples it's seen are blue.
Right.
So this is where we cut through and be different and do the things machines can't do.
That's right.
Yeah, I love that. So when you're thinking about how this connects to sort of commercial performance, how do you end up having that conversation with, stakeholders?
That is a really good question. And that is something we are challenged with even more right now in a tighter financial landscape, I would say, from a budget perspective. It is something that we have to work really closely with our clients on. If we're talking about a digital environment and you're talking about an unbranded website that's delivering tools, of course, we can track all of the conversions to a branded website, but we don't know if they ever went on a script. We just don't know, right? So there is a, we can talk about driving leads and then look at performance and see if there's some sort of connectivity, but just being really honest, it is basically impossible to always say, like, did the campaign really convert into more scripts? But what we often do as well is look at like a net promoter score for our manufacturer. And I think that as we look at, the trust of the system, we are so proud that our clients are ranked at the highest. And that brand loyalty, that manufacturer loyalty, and I'm talking HCP and patient, speaks volumes. So if we can build trust between manufacturer, patient, manufacturer, HCP, and show those metrics, that to me is really an important data point for us that is tied to brand, because those HCPs are going to write scripts, right? And tied to brand because patients are going to go, hey, I'm interested in that product because I really think that manufacturer and their support network understands me. Of course, you're going to have the challenges of a competitive landscape and what product is best suited for each patient. I mean, at the end of the day, that's a reality, but if we can help drive choice based off connectivity in an unbranded way, I think it's incredibly powerful. And we've seen that over 20 years.
Yeah, you're talking about sometimes it's very hard to measure the lagging indicators because the connections aren't there. But if we have this sea of leading indicators that we know drive those lagging connectors, we can measure them. And I think also you're talking about the types of brand building and trust building. I don't want to be over commercial for a second, but that is long-term monetization, right? It isn't just about this product. It's about all your future products.
Very much so. It really is. It's about that portfolio of products. It's so much bigger. It's an investment in that platform, if you will, right? So, but yeah, it's something where every company's challenged with that, with the measurement of these unbranded disease state initiatives.
I'd love to know, what is it that companies do badly or wrong in this space that if they just stopped or fixed it, they and everyone else would reap the benefits of?
I believe that how marketing dollars are spent is not always what's right for the community and the realities of what they need. If companies would stop and say, okay, I have 10 million in my marketing budget, they'll just immediately sort of say, okay, go hire XYZ agency and give them whatever because they've done this 10 times before. Instead of looking and going, well, wait a minute, this is a rare disease. We actually need to push much more into community building and, connection. It's a little bit of an afterthought sometimes, if that makes sense. So I feel like trust would be escalated if we really looked at not what you're expected to do from a marketing playbook and getting your MBA. It's like this pie and what it's supposed to look like. But instead just flipped the script and thought, okay, how can we build trust foundationally? And I'm not saying don't do your campaign, but the allocation of those dollars is always mind-blowing to me. What's left for unbranded or education is often just the couch change that they can find, and it's not specifically allocated to the right initiatives.
So talk to me about community, because you told us earlier about how you're on the ground with these patients, with these advocacy groups. It seems, as a human, I can't imagine a bigger or more impactful way to build trust with the audience I need to reach. And yet it sounds like we're not investing in that. So I'd love you to just talk me through, like, you're making an impassioned plea to me why we are going to move dollars into these levers, because actually they're the biggest levers.
Yeah, they are. I mean, if I could bottle up measurement and have like the real data to prove it, I'd be winning all day, right? But there's no question we are human beings. We thrive on real life interaction. We thrive on connecting and people listening and feeling supported and safe at our core, who we are, right? And that's what I think they're missing, a lot of companies. And listen, I'm all digital. As we know, it's the majority of our business is digital. But I do think that, it's just sort of like, hey, go this other non-personal route because it's, we can cast a big net instead of, it's not even that big of an investment to do the grassroots like we talked about in terms of financial. We can get in there, have the conversations, show up in an authentic, meaningful, real life way. We're in a post-COVID remote world. So it's a really big challenge. And I think something that we're always trying to pull that lever and get people to think about it differently, but it's hard.
Liz, thank you so much for joining us. Learned a lot. Paul, thanks for help. Thanks for the help with the co-hosting responsibilities.
Absolutely. It was fun.
Yeah, good fun.
Good stuff. Good stuff.